Good afternoon, everybody, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have had 367,395 cases. 2,883 new cases have been reported since yesterday. A record high 2,033 people in the hospital, and sadly 5,284 people who've died. Our prayers are with those who've lost loved ones to this cruel virus. We're seeing cases and hospitalizations rise steadily, as are many states across the country. We're continuing to monitor the data and the trends closely. We need to keep doing what we know works. Wearing a mask anytime we're with people from another household, and social distancing anytime we leave our homes. As concerning as the numbers are, I and many other North Carolinians have newfound hope in the development of promising vaccines. Moderna and Pfizer both have produced vaccines with remarkable early results, better than health experts ever hoped for. What we know so far is this: safe, effective vaccines should be available soon. Our job is to be ready to get them to people as quickly and effectively as possible. North Carolina is working hard to hit the ground running when these vaccines are approved and shipped. For months, our Department of Health and Human Services has been developing a plan to distribute the vaccines so that we can get past this pandemic. But there's still a lot of work to do to get the vaccines from the manufacturers to our health care providers like hospitals and health departments, and then ultimately to each of us. Our state is preparing to receive the Pfizer vaccine that requires ultra-cold storage. Healthcare providers with these capabilities have been identified across North Carolina. We're a big state, though, with rural areas that stretch for hundreds of miles. Every person is important, and we'll work hard to overcome the challenges that our geography presents. The COVID-19 vaccine will be free, regardless of whether someone has health insurance. Healthcare providers are being enrolled in the vaccination program based on their ability to reach priority populations, those who are at risk of exposure, like healthcare workers, and those who are at risk of severe illness. Trusted providers like hospitals and local health departments will be among the first to vaccinate people. These vaccines have made progress so quickly because of significant improvements in science and technology, all while following safety protocols. Researchers, like we have right here in North Carolina, have been working on new vaccine technology for several years in preparation for a global pandemic just like this. And when it comes to determining safety, before the FDA will authorize these vaccines, an independent advisory board will review the data for safety. This advisory board has no loyalty to any company, political administration, or individual. The board exists to review the vaccine trials independently. I have confidence in this process. Healthcare workers, people in long-term care, and those at risk for severe illness will come first. But when it's my turn to get this vaccine, I'll be ready to roll up my sleeve. At this time, I'm going to ask Dr. Mandy Cohen, our Secretary of Health and Human Services, to share more with us. Dr. Cohen.